Hello everybody, I'm Dr. Jasneet Kaur. I'm a fertility consultant and an IVF specialist at Millen Fertility Center and Ferti Clinic, Chandigarh. Today I'll be talking to you about a topic called IVF. When do we step up the ladder? Now, we know that majority, say around 80 to 85% of the couples conceive on their own, and it is the remainder 10 to 15% which need some assistance. Even amongst them, majority of them conceive with simpler treatment options like maybe an ovulation induction with follicular monitorings, an IUI cycle or a laparoscopy. And it is a very small percentage that need help with the help of an IVF cycle. Now, it is important for a reproductive medicine specialist to guide patients as to what is their right time for going ahead with an IVF cycle. Now, the indications of IVF or when is the time to climb up the ladder are, first of all, if the woman has any tubal factor, that is, if her tubes are blocked. Now, if the woman is young, we counsel them to go ahead with a laparoscopy. If her tubes are found to be patent, we give them a time of around 6 months to 1 year and aid them in conceiving with the natural way. However, if she fails to conceive with that, we tell them that she needs to move ahead with an IVF cycle. Also, women who are older, who have a limited reserve with tubes blocked, they are counseled to move ahead with an IVF cycle quicker. Next is couples in which the male partner has severe oaths or a severe male factor. Now, at times we come across couples who have, a severe abnormality in their semen parameters, and we know that simpler treatment options like IUI is not going to help them. So in that category of patients, we tell them to go ahead with an IVF and ICSI cycle. At times, we do not get sperms even from their ejaculate. So in those cases, we go ahead with TISA-ICSI, that is, the sperms are retrieved from their testes. Thirdly, we have couples who have grade 3 or grade 4 endometriosis, in which again simpler treatment options are just going to waste their times in majority of the cases. So in those patients also, we tell them to go ahead with an IVF cycle. Now, another interesting category of patients are those with unexplained infertility. Now, this subset of patients, do not have any abnormality on the tests that we normally do to evaluate an infertile couple, but simpler treatment options have not helped them. They've undergone a laparoscopy, they've undergone IUI cycles, but nothing seems to help. So in that subset of patients, rather than trying to find out the cause, it is important that we guide them to move ahead with the IVF cycle in time. That is, when she's younger, when she has a good reserve, rather than, when it's too late. Another, newer indications for IVF include, IVF done for egg freezing, say for social egg freezing. Now we know that women are becoming more career oriented, and actually starting a family has taken a backseat for some. So in that category of women, we must explain to them that their biological clock is ticking. Women are born with a fixed number of eggs, and as she ages, there's going to be a decline both in the quantity as well as the quality of her eggs. So to pause this phenomena of the clock ticking, we advise them to go ahead with social egg freezing. She undergoes an IVF cycle, she freezes her eggs or her embryos if she has a partner, and then they are ready to be used whenever she wants to start her family. Also, another indication for egg freezing or embryo freezing is patients who have cancer. They need to undergo cancer therapy in the form of chemotherapy or radiotherapy, which in turn is going to, actually prevent them from having their own biological child in the future. So in those women also, we offer them egg freezing or embryo freezing before they undergo their cancer treatment. Also, another indication of IVF is IVF done for, IVF done with pre-implantation genetic testing of embryos. We have some couples who have genetic diseases like thalassemia, and they do not want this disease to be passed on to the next generation. So in those cases, we do IVF, we biopsy the embryos, and we ensure that they are disease free, and only then they are, transferred in the women's womb. So these are some of the few indications of IVF. So as a reproductive medicine specialist, it is very important for us to counsel our patients what and when is the right time to climb up the ladder, when they should go ahead with IVF, and ensure that it's not too late when they are going ahead with the procedure. I hope you like this video, and thank you all so much for your patient hearing.